Surgeons of Reddit, what was your biggest, oh shit moment during surgery? Oh, our nurse here. This is kind of long one. I was taking call one night and woke up at 2 in the morning for a general surgery call. Pretty vague, but at the time, I lived in a town that had large populations of young military guys and avid meth users, so late night emergencies were common. Got to the hospital, where a few more details awaited me. Perirectal abscess. For the uninitiated, this means that somewhere in the immediate vicinity of the arsehole, there was a pocket of pus that needed draining. Needless to say, our entire crew was less than thrilled. I went down to the emergency room to transport the patient, and the only thing the ER nurse said as she handed me the chart was, "Have fun with this one." Amongst healthcare professionals, vague statements like that are a bad sign. My patient was a 314-pound Native American woman who barely fit on the stretcher I was transporting her on. She was rolling frantically side to side and moaning in pain, pulling at her clothes and muttering Hail Marys. I could barely get a name out of her after a few minutes of questioning, so after I confirmed her identity and what we were working on, I figured it was best just to get her to the anesthesiologist so we could knock her out and get this circus started. She continued her theatrics the entire 10-minute ride to the OR, nearly falling off the surgical table as we were trying to put her under anesthetic. We see patients like this a lot, though. Chronic drug abusers who don't handle pain well and who have used so many drugs that even increased levels of pain medication don't touch, simply because of high tolerance levels. It should be noted, tonight's surgical team was not exactly wet behind the ears. I'd been working in healthcare for several years already, mostly psych and medical settings. I've watched an 88-year-old man tear a 1 inches diameter catheter balloon out of his penis while screaming, "You'll never make me talk." I've been attacked by an HIV-positive neo-Nazi. I've seen some shit. The other nurse had been in the OR as a trauma specialist for over 10 years. The anesthesiologist had done residency at a level 1 trauma center, or as we call them, knife and gun clubs. The surgeon was ex-army and averaged about 8 words and 2 facial expressions a week. None of us expected what was about to happen next. We got the lady off to sleep, put her into the stirrups, and I began washing off the rectal area. It was red and inflamed, a little bit of pus was seeping through, but it was all pretty standard. Her chart had noted that she'd been injecting IV drugs through her perineum, so this was obviously an infection from dirty needles or bad drugs, but overall, it didn't seem to warrant her repeated cries of, "Oh Jesus, kill me now." The surgeon steps up with a scalpel, sinks just the tip in, and at the exact same moment, the patient had a muscle twitch in her diaphragm, and just like that, all hell broke loose. Unbeknownst to us, the infection had actually tunneled nearly a foot into her abdomen, creating a vast cavern full of pus, rotten tissue, and fecal matter that had seeped outside of her colon. This godforsaken mixture came rocketing out of that little incision like we were recreating the funeral scene from Jane Austen's Mafia. We all wear waterproof gowns, face masks, gloves, hats, the works, all of which were as helpful as rain boots against a fire hose. The bed was in the middle of the room, an easy 7 feet from the nearest wall, but by the time we were done, I was still finding bits of rotten flesh pasted against the back wall. As the surgeon continued to advance his blade, the torrent just continued. The patient kept seizing against the ventilator, not uncommon in surgery, and with every muscle contraction, she shot more of this brackish grey-brown fluid out onto the floor until, within minutes, it was seeping into the other nurse's shoes. I was nearly 12 feet away, jaw dropped open within my surgical mask, watching the second nurse dry heaving and the surgeon standing on tiptoes to keep this stuff from soaking his socks any further. The smell hit them first. Oh god, I just threw up in my mask. The other nurse was out. She tore off her mask and sprinted out of the room, shoulders still heaving. Then it hit me, mouth still wide open, not able to believe the volume of fluid this woman's body contained. It was like getting a great big bite of the despair and apathy that permeated this woman's life. I couldn't ducking breathe, my lungs simply refused to pull any more of that stuff in. The anesthesiologist went down next, an ex-NCAAD1 tailback, his 6'2" frame shaking as he threw open the door to the OR suite in an attempt to get more air in, letting me glimpse the second nurse still throwing up in the sinks outside the door. Another geyser of pus splashed across the front of the surgeon. The YouTube clip of David at the dentist keeps playing in my head. Is this real life? In all operating rooms, everywhere in the world, regardless of socialized or privatized, secular or religious, big or small, there is one thing the same. Somewhere, there is a bottle of peppermint concentrate. Everyone in the department knows where it is, everyone knows what it is for, and everyone prays to their gods they never have to use it. In times like this, we rub it on the inside of our masks to keep the outside smells at bay long enough to finish the procedure and shower off. I sprinted to the central supply, ripping open the drawer where this vial of ambrosia was kept, and was greeted by an empty ducking box. The bottle had been emptied and not replaced. Somewhere out there was a godless bastard who had used the last of the peppermint oil, and not replaced a single ducking drop of it. To this day, if I figure out who it was, I'll kill them with my bare hands, but not before cramming their head up the colon of every last meth user I can find, just so we're even. I darted back into the room with the next best thing I can find, a vial of mastisol, which is an adhesive rub we use sometimes for bandaging. It's not as good as peppermint, but considering that over 1/3 of the floor was now thoroughly coated in what could easily be mistaken for a combination of bovine afterbirth and maple syrup, we were out of options. I started rubbing as much of the mastisol as I could get on the inside of my mask, just glad to be smelling anything except whatever slimy demon spawn we'd just cut out of this woman. The anesthesiologist grabbed the vial next, dousing the front of his mask in it, so he could stand next to his machines long enough to make sure this woman didn't die on the table. It wasn't until later that we realized that mastisol can give you a mild high from huffing it like this, but in retrospect, that's probably what got us through. By this time, the smell had permeated out of our OR suite, and down the 40-foot hallway to the front desk, where the other nurse still sat, eyes bloodshot and watery, clenching her stomach desperately. Our suite looked like the underground river of ooze from Ghostbusters 2, except dirty. Oh, so dirty. I stepped back into the OR suite, not wanting to leave the surgeon by himself in case he genuinely needed help. It was like one of those overly artistic representations of a zombie apocalypse you see on fan forums. Here's this one guy, in blue surgical garb, standing nearly ankle deep in lumps of dead tissue, fecal matter, and several liters of syrupy infection. He was performing surgery in the swamps of Dagobah, except the swamps had just come out of this woman's ass, and there was no Yoda. He and I didn't say a word for the next 10 minutes as he scraped the inside of the abscess until all the dead tissue was out, the front of his gown, a gruesome mixture of brown and red, his eyes squinted against the stinging vapors originating directly in front of him. I finished my required paperwork as quickly as I could, helped him stuff the recently vacated opening full of gauze, taped this woman's buttocks closed to hold the dressing for as long as possible, woke her up, and immediately shipped off to the recovery ward. Until then, I'd only heard of alcohol showers. Turns out 70% isopropyl alcohol is about the only thing that can even touch a scent like that once it's soaked into your skin. It takes 4 or 5 bottles to get really clean, but it's worth it. It's probably the only scenario I can honestly endorse drinking a little of it too. As we left the locker room, the surgeon and I looked at each other, and he said the only negative sentence I heard him utter in 2.5 years of working together, that was bad. The next morning the entire department, a fairly large floor within the hospital, still smelled. The housekeepers told me later that it took them nearly an hour to suction up all of the fluid and debris left behind. The OR suite itself was closed off and quarantined for 2 more days, just to let the smell finally clear out. I laugh now when I hear new recruits to healthcare talk about the worst thing they've seen. You ain't seen shit, kid. TLDR, don't shoot IV drugs into your taint. I'm a med student. A surgeon once told me that his oh shit moment was when a patient of his had a carotid artery blowout, very bloody, leads to death within minutes if not treated, due to a tumor growing into that artery. Problem was that the patient was in a small hospital in his hometown with no surgeon available who specialized in this type of cases. Furthermore, there was no way of getting the patient in time to our center as it was rush hour on a sunny Friday afternoon. It was also not possible to transport the patient to our center by helicopter, as the hospital in his hometown did not have a helipad. Luckily our hospital did have a helipad with a helicopter available, so they took the surgeon by helicopter to the smaller hospital. Since there was no helipad at the hospital, the pilot was forced to land the chopper in a park, and mind you it was a sunny Friday afternoon, so it was full of people. As soon as the chopper landed, a crowd formed around the helicopter. The surgeon told me that the moment he exited the chopper, they all started clapping and cheering for him, making him feel like a star. He ran to the hospital and into the operating room and immediately started operating on the patient. He was done around 2 AM, but the patient made it. My father is a physician, and although he's not a surgeon, he did some surgery while in med school. He told me a story about a patient he had once, who had necrotizing fasciitis, or flesh-eating disease. The patient had gotten a cut during gardening and never cleaned the wound. My dad told us that he had to peel back layers just to get at it. First, he peeled off the bandages that the patient self-applied, then there was a layer of holy book pages that he also had to peel off. Following that, there was another layer of bandages, and then a final layer of more holy book pages. Beneath that, there was the wound itself, which was covered in maggots. Apparently, they were eating the dead tissue generated by the disease. He said that once they removed the maggots, they were able to begin the surgery to remove the infected areas, but it was because of the maggots that they didn't have to amputate the limb. After this operation, my dad decided to not pursue surgery and focus on becoming a specialist. I'm currently in med school, and this happened a few years ago when I was attending surgery classes. One patient was up for a laparotomy for removal and investigation of an abdominal mass, probably cancer. Imaging tests were really not specific or of much help, as this was some atypical disease presentation. Even specialists couldn't figure it out. To everyone's surprise, the patient's cancer was really a forgotten gauze from some previous surgery. The actual moment of realization went as the surgeon just stopped and said, "Gauze," to which the nurse promptly gave him one, and he went, "No." There was a gauze inside of him. I am a nurse, and the doctor was an anesthetist, but still relevant. Patient had her surgery, I can't remember what, all went well. She was awake and in recovery. We needed to give her a medication through her IV line, so, as is standard practice, we flushed the line with 10 milliliters of saline. The patient immediately stopped breathing, we had no idea why. We called a code and the anesthetist came running. He actually said, "Oh shit," when he realized what had happened. During the surgery, the anesthetist had given the patient rocuronium through that IV line, and he hadn't cleared the line afterwards. So when we flushed the line, the patient got a dose of rocuronium that had been sitting in the line. Rocuronium is a muscle relaxant, used to inhibit the respiratory muscles to allow for intubation and ventilation during general anesthetic. In layman's terms, it paralyzes the breathing muscles, so you can't take a breath no matter how hard you try. But it does not put you to sleep. This patient was wide awake, but totally unable to breathe. Luckily the anesthetist worked out quickly what had happened, and it's easily reversed. The patient was physically fine, but understandably traumatized. I'm not a surgeon, but I was a patient. This one time the anesthesiologist came to my room before surgery and injected me with something, I don't remember clearly. But the moment they made the first incision, I woke up and screamed so loudly that the guard of Hades would die. Turns out I was still conscious but fell asleep while counting from 10 to 1. The anesthesia was not proper, and I got the surgery 3 days later with the proper anesthesia. Edit, the scream is an expression, but I carved out a little bit of my thigh so that it would bleed to catch the attention of the doctors.